Clinical Pharmacy Adherence Optimization Part 6. In this video I'm going to talk about considerations for special populations. Although the problem of non-adherence affects all ethnic and age groups, some populations are more vulnerable than others. Pharmacists should be especially alert for adherence problems in high-risk populations, such as elderly, children, low literacy individuals, and some ethnic minorities. In this video, I'm going to talk about elderly population. Although older Americans aged 65 years and older account for less than 15% of the population, they consume about 33% of all prescriptions medications and 40% of non-prescription drugs. Poor adherence in the elderly often leads to additional physician or emergency department visits, hospitalizations, and uncontrolled chronic diseases. One study estimated that about 17% of elderly hospitalizations are due to adverse medication reactions, nearly 6 times the rate in the non-elderly population. A variety of often interacting risk factors increase the risk of non-adherence among the elderly. These risk factors in such population include: first, polypharmacy. Elderly patients are more likely to take multiple medications, including both prescription and non-prescription products. Whenever possible, the medication regimen should be simplified. The pharmacist also should consider the extent to which the mode of drug delivery may influence adherence. For example, if the patient prefers pills, patches, or inhaler as applicable. Second, physical impairment. Age-related physical disabilities such as difficulty getting out of bed or a chair may limit an elderly person's ability to take medication consistently. Individuals with arthritis in their hands, for example, may have trouble opening containers, so in such a case it is preferred to give them the drug in a unit dose package. Another example, elderly patients with hearing problems. They may need a quiet place to receive patient counseling, so they will not be distracted by ambient noise. In addition, population with vision problem. In such a case, it is preferred to give them written materials in a large type or font, so it will be easy for them to read the instructions. Third, cognitive limitations. Memory loss and other cognitive problems may interfere with the adherence by causing patients to fail to understand or remember medication instructions. For these patients, pharmacists may need to provide medication instructions several times and in different formats, such as both verbal and written information. Fourth is limited access to healthcare services. Elderly patients who are unable to afford certain medications may be eligible for aid or special discount from pharmaceutical manufacturers. In addition to all this, pharmacists should also consider how an elderly patient's relationship with other healthcare providers might influence adherence. For example, research shows that the elderly tend to favor partnership-type relationships with their physicians and that satisfying patient-provider relationship and contribute to better adherence. However, with the growing number of managed care and group practices, these relationships are often more difficult to develop. A good pharmaceutical care plan can help elderly patients relate more effectively with primary care providers by helping these patients understand the nature of their diseases and how to better communicate their needs to physicians. In addition, the role of patient's caregiver in helping or hindering medication adherence also should be considered. A motivated and well-informed caregiver can be essential for optimizing adherence in an elderly patient. On the other hand, caregivers can sometimes hinder adherence efforts. For example, a caregiver who is having trouble coping with an elderly patient's behavioral or cognitive problems may demand medication to sedate the patient. In such a case, pharmacists who serve communities with a large elderly population may wish to hold special classes to teach caregivers about medication management, addressing topics such as medication administration and how to monitor and report adverse effects. In the next video, I will talk about other special populations whom need consideration. Thank you.